In the U.S., deaths related to opioid overdose have quadrupled since 2001. 80% of heroin users began using with prescription painkillers. Prescription opioid abuse costs the United States $55 billion a year in healthcare, criminal justice, and lost productivity. In 2015, pharmaceutical company revenues for opioid painkillers reached $15 billion. Have you or a loved one been prescribed opioids at some point in your life? 1 out of 5 patients with pain-related diagnosis are prescribed opioids, so the answer to that question is more than likely yes. While prescription opioids are effective in treating chronic pain, they are the root of the opioid epidemic. The opioid epidemic is the deadliest drug overdose crisis in U.S. history. It is killing tens of thousands each year, and it is estimated that hundreds of thousands more in the upcoming decade will also fall victim. Opioids are overprescribed indefinitely. As stated before, they are effective in treating chronic pain, but are handed out for lesser than serious or for longer periods of time than needed, leading the patient to feel the side effects opioids have on the body. Opioids block pain and cause a euphoric feeling by binding to opioid receptors in the brain and triggering the release of dopamine. Essentially, opioids hijack the limbic system of the brain, inducing a euphoric high that the body unsuccessfully tries to replicate on its own. Because of difficulty in either obtaining or affording opioids, those who find themselves addicted often turn to a much cheaper alternative: heroin. Heroin replicates the high oxycodone creates at a much cheaper dollar price, but at the risk of the user's life. Heroin suppresses the part of the brain that controls essential functions, and as a result, breathing slows down or ceases entirely, leading to the accumulation of carbon dioxide in the blood. From the time of injection to death, a heroin overdose is approximately 90 seconds. It may seem as easy as putting the drug down, but addiction is a real disease that people unsuccessfully fight daily. Those who become addicted find their brains obsessed with the rush that all too often leads to an untimely death. Opioids may sometimes be a good answer for those who suffer from chronic pain, but should not be prescribed as first-line treatment due to the grave risks involved. Alternatives should always be considered first. You may be wondering why doctors and pharmaceutical companies alike still prescribe opioids as a first option. Purdue Pharma, one of the largest pharmaceutical companies in the U.S., first marketed oxycodone and campaigned for doctors to prescribe oxycodone for all kinds of conditions. Purdue won FDA approval for oxycodone in 1995, eventually generating $35 billion in revenue. At the rate of the current opioid epidemic, death tolls will reach millions. It may now seem questionable as to why prescription opioids are still legal, but is there a safer option for treating pain? There has been substantial evidence that marijuana can relieve pain at a lower risk of addiction than opioids with virtually no risk of overdose. Medical marijuana has been proved to ease chronic pain, neuropathic pain, and is useful in the treatment of cancer. The active compound in marijuana, called THC, produces a kind of euphoric high, but as stated before, has a low risk of addiction and no risk of death. Studying prescription data from states reveal a correlation between legal medical marijuana laws and a reduction in opioid abuse. Advanced research on the efficiency of marijuana in the medical field is necessary, but the label placed on marijuana as being an illegal Schedule I controlled substance is a large obstacle in proceeding forward. Overdose caused by ingesting marijuana is physically impossible, but prescription opioids are the root of the reason as to why Americans are dying by the thousands annually, and no such label is placed. While there isn't one simple solution to the opioid crisis, data proves that medical marijuana could play a major role in treating pain effectively, as well as curbing the epidemic sweeping our nation. So what can you do to help save lives? The first step in major change is always as simple as this: awareness. Pharmaceutical companies are making a monopoly on human lives while being completely aware that there are better methods of treating pain. Politicians seem to be blind to this issue because of the funding these companies offer, both the position of office as well as political campaigns. Call your local senator and speak your mind on how you feel about this issue and ask if they are funded by Big Pharma. While it seems an individual's voice won't go very far, every voice makes a difference, and you will be helping the movement to save lives. Spread the word and urge others to call before countless lives are continuously lost. We live in a democracy, and the notion of change lies with the individual. With nationwide awareness of the truth behind opioids, we can and will successfully end the opioid epidemic and save millions of lives.